Hello, everyone, and welcome. My name is Sally Guy. I'm the Director of Policy and Strategy here at the Canadian Association of Social Workers. And I'm so happy to be moderating today's presentation, which is a collaboration between CSW and the Muriel McQueen Fergusson Centre for Family Violence Research. We also call it the MMFC, on violence against women with disabilities. So before I introduce our speakers, I'll cover some quick formalities. This webinar is being recorded, so you can access it at any time by logging in the same way you did today. The link is on our website under the Continuing Education tab if you want to look for that. The slides are available for download right now under the resource widget at the left of your screen. And as always, a certificate of attendance will be available at the end of the presentation. So just click on the yellow icon at the bottom of the window to access that once 45 or so minutes have elapsed. So finally, the speakers will be asking for feedback on certain questions. And there will also be time for regular Q&As at the end. So I do encourage you to type in your questions, comments, and share your experiences with us in the box at the top left of your screen. Of course, we'll only have time to share some of them with the whole audience, but just rest assured that all the comments submitted will help further research and understanding of this really important topic. So with that said, it's my honor to introduce our speakers. Our first speaker is Angela Wisniewski, who has a PhD in sociology and is an assistant professor at St. Thomas University. She focuses her research on the areas of gender, media, technology, and she's a research affiliate with the MMFC, where she has experience collaborating with community organizations and government on the issue of intimate partner violence in rural communities. Our other guest today is Rina Arseneault, and she's the associate director of the MMFC and has been since 1993. She's a recognized activist and educator on women's issues, and she's organized numerous training opportunities and workshops. Her experience is extensive and includes work with community organizations, individual researchers, government agencies, the media, and of course, victims of violence. In 1997, Rina was honored with the New Brunswick Advisory Council on the Status of Women's Recognition Award, and in 2014, she was appointed to the Order of Canada for her work. Finally, we have three social work students with us as well. Larissa Rose, Maggie Newcomb, and Vanessa Moran McDonald are all students at St. Thomas University and who are completing a social action practicum placement at the MMFC. So with that said, it's clear that we are in expert hands for today's webinar, and I will turn the microphone over to our speakers.
Well, thank you so much, Sally, for that introduction. Very appreciated. Thank you for everybody joining us today. We have a pretty a long presentation, but we're going to try to give you as much information as we can, but we'll try to also keep some time because we really want some feedback from all of you. One of the things, I'll give you a quick outline of, a quick outline of our presentation. We hope to talk a little bit about our study on violence against women with disability. How did the violence against women with disability research team got started? Give you a little bit of the aspect of violence against women with disability that we were studying. We did an online survey. We'll talk to you a little bit about that. We'll also give you a little flavor of our first focus group, and we'll then have more time for discussion. Certainly, any study such as this one doesn't start by itself, and we need to remember the context of IPV has changed through the years. I've been working on this issue now almost 35 years, and I swear that there's a lot of things that have changed, but we still have so much to learn. We know that government departments and community organizations now respond differently as they did at one time. 35 years ago, the only responders were transition houses. As now, we see a lot more. We see social workers that are much more, that have much more information on how to intervene. We have police officers that have been better trained. We have also Crown and all the justice system that have received much more training. And I don't know across the country, but I know that in the Maritime, especially New Brunswick, we are heading towards a lot more training of Crown prosecutors and judges. So we know that it is much more understood than before, but we also know, even though that there has been that even with all these changes, IPV is still going unreported. And it is imperative that we learn from the experience of women who have sought help to progress further. And one of the things that I got to say is that we have become better accustomed to ask those big questions. But when we start looking at intersectionality, we're not as good. And so we know that, especially women with disability, for this presentation, we know that they're a vulnerable population.
Okay, thank you, Rina. This is Angela, and I just want to speak for a moment about why we chose to focus on disabilities, women with disabilities, for this project. So we came to this project with a certain understanding of disability, and that understanding, I think, is based most importantly on the idea that there's not sort of a one-size-fits-all experience of disability. Rather, there are diverse experiences of disability that run along the spectrum from visual impairments to cognitive development problems and so on. So we really wanted to emphasize that variation. We also it was important to us to use a human rights-based approach in understanding disability. And so as such, we're following the United Nations definition of disability, which you can see on the slide in front of you, which emphasizes that disability can refer to any impairment that places a limitation on participation or on one's activities. And we feel that this is an important approach in the sense that, as you can see in italics, as you can see highlighted, this human rights-based approach emphasizes that it's not so much the focus on the individual and the individual's health or capabilities as it is a desire to understand the elements of society and of our built environments that create barriers to participation or that can become impairing for people under different circumstances. So we recognize that the issue of violence against women is something that happens to women from all walks of life, yet we want to emphasize some particular ways in which this may be a problem for women living with disabilities. So women living with disabilities, we know from the literature, we knew going into this study, and would share with you that they are vulnerable to all variations of abuse, including neglect, physical abuse, sexual abuse, financial abuse, and psychological abuse. Survey results of Canadian women show that women who are living with a disability experience intimate partner violence at a rate of 1.2 to 1.4 that of women who are not acknowledged to have any kind of disability. We also see that there are concerns around the severity of violence against women with disabilities. So it's 2 times more likely that these women will experience severe physical violence, things like being beaten, kicked, bit, or hit, and 3 times as likely that they will be forced into sex, either by being threatened, held down, hurt, and so on. So those are some of the reasons why we are concerned and want to prioritize this particular study. We also think that there are unique dynamics to violence against women with disabilities. In particular, you'll notice that throughout the slides, instead of using our standard meaning of IPV, which is intimate partner violence, we've chosen instead to use the terminology of interpersonal violence. And that is because women with disabilities may face abuse from other family members who are not intimate partners, as well as caregivers and strangers. We wanted to draw your attention to that. To speak a little further to the idea that there are particular dynamics of disability against or disability-related violence, Plummer and Findley give us the concept of disability-related abuse. So they argue that women with disabilities are vulnerable to the exertion of power and control by their primary caregivers. They often experience physical violence that is coupled with emotional abuse, and that often is related to a partner who will stigmatize or shame a woman for her disability as part of the experience of abuse. There are also other forms of disability-related abuse to be aware of, though. For instance, there are problems such as withholding medication, denying access to mobility and other assistive devices, neglecting the personal care needs of the person with disabilities, and preventing the person with disabilities from attending things like doctor's appointments. So these particular dynamics of IPV also come back to problems when women seek help. So we know that there are certain barriers to help seeking. Those include problems such as common gateways to services such as hospitals, police stations, and courts having really inconsistent accessibility. So some may have translating services, or some may have things like wheelchair ramps, and others will not. So that becomes a barrier in and of itself. And in particular, these barriers are also found in relation to housing. So shelters often struggle when it comes to things like accommodating medical equipment, providing wheelchair access, and providing housing for things like guide dogs, or space indeed for one's personal attendants if you require an attendant or assistant to live with you. So those are just some of the issues that we think are important to try to better understand.
Now, here is where we share the question that we hope that we'll be able to discuss. And we're just going to read them quickly now so that you can begin to think about them. And maybe that will help the discussion after the presentation. We are looking for stories of intervention that went well. What did that look like to you? Lots of time we talk about the challenges, the barriers, but many times in many places there is a lot of intervention that went well, and we'd like to learn from them. The second question, what were some of the hurdles that you needed to jump over in order to effectively help? The third one, do you feel confident in your ability to break down silos and reach out to the disability and interpersonal violence organization in your area, or to refer your clients to the services? And the last one, do you have any resources that should be included in a toolkit for service providers working in both the interpersonal violence field and the disability field? And we'll talk a little bit more about a toolkit at the end of our presentation. Now, we'll talk a little bit more about how we got started. And certainly, like every good project, it starts by another project. And in this particular case, it started by a project that we had, the Muriel McQueen Fergusson Centre had with the New Brunswick Association of Social Workers, where we wanted to know from survivors what helped in the formal system and in the informal system. And so we prepared, and we thought, well, we wanted to have information from them. And we did that project that's called Action for Change, Empowering Women Victims of Intimate Partner Violence to Build Healthier and Safer Lives. And in that particular case, and that's when we first started to begin thinking about the different intersectionality of intimate partner violence, indeed, two of the women were disabled. Neither one of them could could hear or could speak. And we thought we had it all. We had it all writing. We had a big book. Everything was written. But many times they had, and thank God we did have sign language translators that helped us understand their living experiences. And many times they had to stop us. So even though the information that we had in front of us in writing was about grade 4, grade 6 level, a lot of the wording we were using were not part of the sign language, so could not be translated. And so that was very eye-opening to us. And they were starting to talk to us about how, through their own schooling, what they were schooled for was how to fit our world. And that's, instead of math and French and English grammar, they got a lot of courses on how to fit inside the able world. And so we learned a lot that day, and that's when we decided there was a lot that needed to be done. So after this particular project was finished, we applied through the funding for under the Canadian Observatory on the Justice System Response to Intimate Partner Violence. And we currently call this little project the Rural Project. And we learned a lot through our Rural Project. And that was one of the ones that I'll talk a little bit more later, but where we realized that women with disability were not seen. We're not accessing our services. And that became really, going through the province and talking to service providers, that became a really important issue for us because we thought, well, there's an entire section that we're not seeing.
Yeah, so to just build on what Rina has said, you know, one of the first questions that we came away with, an immediate question that we came away with was this question of what help women are actually finding if they're so absent from and underrepresented among the people who are being seen by court workers, police, etc., all of these different service providers. And we had many, right, in the Rural Realities Project. We had everything from health-related and addiction-related providers to you know, to schools, to child protection officers. Like, we had many, and they weren't seeing women, yet women with disabilities are over 17% of the population of New Brunswick. So we thought this is clearly a problem. And this caused us to reflect a little bit on some of the broader trends that women were reporting about their experiences of seeking help in rural communities. And one of the standout ideas from that study was the question of access. Access showed up in a variety of ways as we looked at what service providers were telling us. And we found that there was a problem of access that all women are experiencing living in rural communities because key service providers like police were not stationed nearby where they lived, and so there were long response times. This could lead to a feeling of isolation. We also saw a problem of access in the sense that there was a requirement to travel to urban centers, even to, you know, do something as simple as sign an application for legal aid. It required a woman to travel, often multiple hours, in order to access you know, the official offices that she would need to access. And this was often a problem given the limited income or given the control that a woman was experiencing in her life. To allow her to actually get out and do those things was a big problem for many women. And finally, the buildings and spaces of courthouses in particular were ones where women reported and shared with us that they were intimidating and difficult to navigate, and they felt unsafe. And so there was an access, I think, an access issue in that sense as well, around the building and spatial design and a women's ability to get to navigate those spaces in a way that felt reasonably safe and empowering. So we thought, okay, for these access issues, especially if we think about disability as being socially constructed and how spaces and social arrangements contribute to creating disabling environments, this is certainly something we see going on there. And then, sorry.
No,
you go ahead, Rina.
And one of the things that really came out is, and I'll just read this statement that was given to us during a focus group. Women with disabilities struggle to be believed. We have many people with limited mental capacity, and therefore their education is not there. Business sense neither. So you talk to them and they say yes, yes, but they do not understand. It is because mentally they're not there. Yes, she gets beaten, but how are we going to bring this to court because her credibility and her words are not good? Now, if you're thinking that this is one of the service providers that are working with women, and especially with women with disability, the attitudes and beliefs and the assumption are very well lived in a lot of our rurality. And that for us really pushed us forward in trying to look at what was happening in our province. And we And so we decided to form a research team. And we have, as you see on your screen right now, we have a very diverse research team. It's a wonderful, a lot of people from the Anglophone and the Francophone side. We have a couple of universities, we have people from government, we have people from communities, we have people from Multicultural Association, with people that works with people with disability, and we have people that also work in the anti-violence field. So really trying to get all the voices around the table, because that was a very important issue. And if we don't have those voices, we may miss some of the most vulnerable.
So as you might already imagine, having heard about the project and how it originated, we like to do multi-stage projects here. And so this is just the beginning of our research on, and we hope also with, women with disabilities. And so over the next 2 years, we want to work on achieving a few different research goals. Importantly, we really do want to make central women's lived experiences. So we want to reach out to women who have been survivors of abuse and learn more about what happened to them, and also what were the supports that were helpful to them. We also would like to learn more about service providers, whether those are service providers working in community-based disability support organizations like community living associations, whether those are anti-violence organizations, and more. So we wanted to know more about the service providers who are providing assistance. We want to know then also through the input of both of those types of people, both of those groups, we want to know where the needs and gaps are right now. So what is the current situation in terms of intervening, identifying and intervening, and then also preventing violence from occurring. And so eventually down the road, we do intend to develop tools that will help to improve that piece. But for now, it's just linking it to the lived experiences of those other groups, and hopefully through that also getting a better sense of the broader social context that creates risk, that creates vulnerability for women with disabilities. So again, this is a multi-stage process at which we are just at the beginning, and we're at the beginning not only in the sense that our research team is new, but also in the sense that we're working with no real baseline of information about the experiences of that 17% of women in New Brunswick that I mentioned earlier. And no funding. So we're getting things off the ground. So our first step was to create an environmental scan that would essentially help us to understand, okay, who out there is working with women when they encounter abuse and violence in their life? How do they offer their services? What is the nature of the supports that they're offering? And what are the needs and gaps that they see in the system right now? So we produced an online survey, distributed it really through our community partners who Rina just talked about. We used their networks to try to reach out to as many different service providers as possible. So again, the people working in community supports for disability, the anti-violence sector. We also reached out to the medical association, people working in long-term care facilities, as well as the provincial Department of Social Development. So we've got a wide range of respondents. You'll hear a little bit more about in just a second. So that I will just add to that in order to enhance and also to verify some of the data that we were getting from this online survey, we have just started the process of carrying out focus groups. We've carried out our first focus group, which is with a disability-related community organization and conducted in English, but as you can see, we'll do both French and English, and we also want to work with service providers in the anti-violence sector.
Now we'll turn it up to Larissa, Maggie, and Vanessa to give us a little, they were the ones, thank God, that helped us analyze the online data. We used SurveyMonkey because of its accessibility and because of its easy access to everyone. So they'll give you a flavor of what we found so far.
So my name is Vanessa. I'm a social work student doing my social action placement, and I'll just begin by giving you an overview of the survey results. So in the English survey, we had 164 respondents in total. In the French survey, we had 34 respondents. 107 of these respondents identified as female and 14 identified as male in the English survey. And there were for the French survey, we had 26 women and 8 men. And 71% of English respondents and 74% of French respondents worked in education, law, social, community, and government services. So organizations where respondents worked, as I'll reiterate, was in the English survey was social development, disability support, healthcare, housing, mental health, and domestic violence. The respondents' role within the organization. On the English side, we had 36% social workers, and as we go down, directors, managers, and support workers. And on the French survey results, we had 36% social workers, and as we go down, coordinators, supervisors, managers, support workers, and directors. Services provided for women with a disability who has experienced violence. We had 65% of Anglophone and 58% Francophones stated that responding to the abuse of a woman with a disability was a part of their mandate. The top 4 services offered related to prevention, education, or response to the abuse of a woman with a disability. On the English survey, we had 72% community referrals, 58% crisis intervention, 33% therapy counseling, 30% community awareness. In the French side, we had, again, community referrals, crisis intervention, therapy, and community awareness. So the types of abuse of women with a disability or abusive circumstances organizations worked with were, on the English survey, 87% emotional violence. And as we go down, intimate partner violence, sexual violence, neglect, financial, self-neglect. On the French survey, we have results stemming from 57% intimate partner violence. And as we go down, sexual violence, financial, neglect, self-neglect, violence against disabled women, and 30% violence against disabled men.
Hi, I'm Maggie. I'm the other student. So then we looked at challenges and barriers for service providers serving this population. English respondents identified appropriate resources, housing, finances, and accessibility. Meanwhile, French respondents identified education and awareness, lack of appropriate resources, accessibility, and isolation. Respondents stated that the following would be the most helpful in working with these populations. English, 26% said resources, 22% said education, 20% training, 12% affordable housing, and 12% referral sources. For French respondents, it was 27% education, 23% resources, and 14% better coordination between services. So we asked 2 questions to both the English and French respondents. For English, we asked how connected they felt to the community. 37% of respondents stated they felt moderately connected to organizations in the community addressing the abuse of women with a disability. Meanwhile, for French respondents, 42% of respondents stated that they felt slightly connected to organizations in the community addressing the abuse of women with a disability. For English, 35% of respondents stated that they felt moderately aware of resources in the community. Meanwhile, French respondents, 32% of them stated that they felt moderately aware of resources in the community. Respondents stated that the following knowledge would be helpful to support organizations related to the abuse of women with a disability. For English, it was intimate partner violence involving women with a disability, mental capacity, intervention models, abuse prevention strategies, and legislation. For French respondents, it also included abuse prevention strategies, financial abuse, violence against men with a disability, negligence, and abuse in long-term care or retirement homes. Respondents stated that the access to knowledge in the following areas would be helpful. For English and French, they both said information on other agencies in your community that works with abuse of persons with a disability. 67% of English respondents said updates on training opportunities on the abuse of a person with a disability, followed by abuse prevention strategies, information on promising practices on the abuse of persons with a disability, current events or news regarding the abuse of a woman with a disability, and statistics on abuse of women with a disability. For French, 64% said training resources on the abuse of persons with a disability, information on promising practices on the abuse of persons with a disability, updates on training opportunities on the abuse of a person with a disability, current events or news regarding the abuse of women with a disability, and information on current research regarding abuse of persons with a disability.
So what does that mean to us, the implication of this study? First of all, I guess, before we start talking about implication, we just did a focus group last week, with service providers working with people with disability. And one of the things that became flagrant during the focus group is the lack of connection with the anti-violence field. They really had no idea who was working with women, abused women. They had no idea how to refer. Some of them knew how to refer, but weren't sure what happened after they did refer. Some of them mentioned that they had never heard of safety planning, and they had never been asked for their advice of what does a safety plan would look like for a woman with disability. So there were some challenges. We're just now transcribing this first one, and we hope to have more focus group. We're certainly going to have some also with the anti-violence field. But one thing that became really important to remember is that we're very good at trying to navigate physical disability, but we're not so good at understanding what are the invisible disability. And so trying to access telephone, trying to access different, or if you're deaf and you're fearful for your life, what does that mean? If there's a big loud noise, you won't hear it. So there's a lot of things that we needed to pay attention to. Another thing that came really important was maybe the importance of training together, win-win situations, so that the anti-violence field could train the people that work with disability on what to look like, what the complexities of violence against women are, and for people that work with people with disability to get people to understand the complexity of people with disability. Now, before we go any further, you'll see that through the study, we've decided to really look at what women with disability experience as violence, not people with disability. And the reason for that was really that we've noticed at the beginning of it all is that people with disabilities seem to be ungendered. We didn't see gendered. People talk with people with disability, but not about women with disability. And the services and the program will be different. And so we decided to do the first step in looking into women with disability. Angela?
Yeah, thanks, Rina. I'll just add that another, discussion point, and one that I think leads into some of the things that Rina and I wanted to discuss in relation to the social model of disability, is the point that really came out quite clearly from this focus group of disability-related supports and service providers, was the idea of vulnerability. And so our participants who worked with people with visual and hearing impairments as well as intellectual disabilities emphasized that the care needs of people with disabilities mean that from a very young age, part of their socialization is accepting close physical contact from others around them, right? You may need that assistance for just your activities of daily living. And so this creates a really early potential vulnerability, and that does not seem to be at all addressed by the existing healthy relationships programming that is out there. So what service providers described was a situation where women with disabilities may be very socialized to accept others looking and touching them, but were not being provided with any kind of alternative messages that were really actually inclusive and available to them that said, hey, this is okay and this is how you can tell someone when it's not okay. They just don't seem to be part of that healthy relationship planning at all. So I think that this is in itself an important point. I also think it underlines the importance of looking at vulnerability as something that is socially constructed. It's not that these are individuals who are incapable of having healthy relationships or that must be vulnerable because of an inherent condition. It is really those gaps and needs in how society is responding to them.
And certainly that brings again the importance of and it was a conversation of demystifying complexity. You know, we talk about the complexity of violence against women and family violence, but we need to demystify, because when we talk about complexity, nobody wants to touch it. But really, it is a lot of time it's about being there. It's about listening. It's about being present. And so there's no the issues are complex, but our intervention is really about respect, trust. It's about being there. It's about understanding where they're coming from and walking with them to whatever intervention that needs to happen. And so that came out very clearly, that it was about trying to understand their lived experience and about walking with them. And it also tells us that we need to be careful around our intake and our screening. We need to remember that trauma-informed lens that we hear about constantly now when we talk about intervention. And we need to know that women with disability is almost like a double whammy, eh? You know, they've been traumatized by violence, and they're also traumatized by the way we, the able people, have dealt with them. And so there's certainly a lack of trust. We have not been there listening and being with them, and so it's very difficult for them to trust that we will be there now. And so those stress issues around being believed are very much ingrained. They don't really believe that we will believe them. And that is also very difficult, and we need to pay attention. So certainly that first focus group, we've learned a lot, and we hope to keep learning so that we can have an influence to program and services. That's certainly something that research at the center is always informed research. We need to inform our program, our services, and our intervention moving forward. Now, yes, Angela? You were just going to say something.
Oh, I was just going to say that I was just listening to you speak and thinking about how that lack of trust is also present in those silos between anti-violence organizations and the disability-related community support organizations, because those disability-related community supports that, we can call for someone or we can bring someone to an office, but then we don't know what happens. We don't know that the response will actually be adequate and helpful, and then we're fearful that that person will never seek help or never say anything again. So there was not any existing relationship there either.
Yes, and some of the comments that we got from the online survey, which was anonymous, talked to the lack of information on both sides. So lack of information with people that work with people with disability by saying, well, that's not our mandate, so we don't look at that. So the being afraid of asking those questions or not knowing how to ask those questions, and in the anti-violence field saying, well, we are here, we're here, we're ready. It's up to them to come to us. And so that lack of understanding of the magnitude sometimes of issues just to get to there. So how can we work better with the two worlds? And certainly for having a conversation with Bonnie Brayton at DAWN, the Disabled Women Network of Canada, that came very clear. And she talked a lot about, and we need to pay attention to, is the trauma of violence. And so if we understand violence through a trauma-informed lens, we then begin to understand the complexity of moving forward. And so we can get the complexity of that brain tremor. So, there is trauma to the brain, and that is a disability as itself. So certainly there was a lot of good conversation that we've had. But now we'd like to know, we'll stop for 1 minute and see from the audience out there if there has been any answers to our questions.
Well, people are I think just sort of sympathizing with you, or they're sort of reacting in a way that is showing me that this conversation needs to take place, and that they're saying, yes, like finally, my concerns about my clients or my community or my organization are sort of being heard. So one of the first ones is really like a plea for addressing intersectional forms of oppression, I think, and it says, I think one of the things we need is more education about how service providers and services can effectively intervene. Workers assume that clients can easily get to their offices, and that needs to be challenged. Service agencies need to make sure women can get in the front door. Groups sometimes hold meetings in inaccessible locations. Even when meetings are held where women can get to them, they're usually not those doing sign language or microphones. We need to reflect on our practice to ensure that we are not creating barriers.
What a wonderful comment. And I'll say thank you to the person that wrote it. And it is so true. And that's one thing that came out loud and clear from our focus group with the people that are working with people with disability, of the lack of awareness of what it means to be disabled and whatever that disability is, because it does stop you from reaching out, or it may be that you don't know how to reach out. And so I don't think, as in anything, it is the people that have the capacity and are capable that should be leaning towards the people that do not have the resources, and not the other way around. I think it is up to us to do a better job. So if I am, let's say, working in a community center, and I know my community has a lot of women with disability, but I never see them, it is me that should ask myself that question. Where are they? How can I go to them? How can I reach out? And I'll give a little example of a place where I won't name where it was, but I was doing a focus group on, and it was for a school, and they were looking at the population of that school, and they said we have a population in our city we have a lot of mothers that are prostitutes. But we don't see the mothers on those days where we ask parents to come forward. And he said, we'd love to talk to them. We'd love to be able to have their input on how to better help them when they're working with their children. And when I said, well, have you ever thought of thinking outside the box and going to them? Oh, they said, oh, no. Parents always come to us. But, we need to think outside that box on how can we get to them and really trying to understand their challenges. I can see it would be a big challenge for me to go to that school and be judged maybe, or to not be understood. So we need to flip that around. And I think that when we're working with women with disability, we need to flip it around. If I remember those two women that were in that group that I was, it was a wonderful learning. They taught us so much that day, actually 2 days. And at the end of those 2 days, I was better informed on how I could move forward. And so it's that learning, and I know that Dawn is doing a lot of research right now in 3 provinces, in Quebec, in Ontario, and in BC, and we're hoping they will also be able to inform this conversation, and we hope that they will be able to inform this conversation in a second webinar that we hope to put together for the Canadian Association of Social Workers moving forward.
Well, I think what you're just speaking to there, which is sort of like a lack of understanding about these issues, is really coming through in the questions as well, that there have been a lot of questions both about some of the terms that you've been using, as well as a lot about the survey itself, actually. But one of the first ones is, and I'll just sort of make it a portmanteau, I'll just combine it with another, is how is self-neglect defined? And I think that would go hand in hand with also, is there somewhere that you could direct us, or that I could post a link to, where social workers and others in this field really could learn more about intersectionality as it applies to disability, and about some of the issues that you're talking about?
Well, certainly we do have some information about intersectionality, and I'd be happy to send it to you, Sally, so that you can send it to people that are asking for it. But another thing that I think we need to be aware of is that when we started this online survey, and when we thought of defining disability and what in all its complexity, we decided not to. We let the people answering the survey and the people that were helping us move forward define it. But as we move forward, we're still struggling. And so who is going to be defined self-neglect? And we're hoping to have focus group actually and individual interviews with women with disability that have experienced violence so that they themselves can define. So if we're looking at self-neglect, I may define it quite differently than a woman that is maybe doing self-neglect. And, you know, we have all different things. I mean, for me, self-neglect could mean a lot of things because I'm an able person. And so, you know, self-neglect could be quite different. But for somebody with disability, I am unsure how they would define self-neglect. Angela, do you need to? Yeah, because it is quite different. And if we look at mental capacity, again, that is another catch-all because mental capacity, it depends on the person. And depend on the person where she is. I mean, if it is a mental capacity because of a brain trauma or a brain tumor, and all of a sudden the capacity is different as before, then you have a before and an after. But how do you really define mental capacity? And so we have a lot of term out there that can be sometimes a barrier by itself because we are so quick in labeling. And so sometimes it is working with people with the ability they have. And like I'll take myself, I am hearing impaired. So I have a disability. Yes, I have hearing aid, and it does create an issue for me. But does it stop me from functioning? No. In some areas, yes, but not all the time. So it depends on how we view it and how we live it. But I think for people that have disability, we have put challenges there and barriers that makes it more difficult for them to navigate our world. Was there other questions?
There's also just a lot of writing in, I think, about frustrations that just like totally confirm the need for studies like this. So someone writes in, I'm thinking right now of a woman that my colleagues and I are trying to work with and that we're trying to help. And she's dependent on her violent partner to bring her to appointments, and he is almost always with her. She is developmentally challenged, and she's in a wheelchair, and she's a bariatric patient, so transportation can always be a challenge as well. So she has a violent husband, needs a wheelchair-accessible vehicle, and she is also dependent on him for transportation, and we just feel helpless for her.
That's such an important point to put forward. And then that happens on a constant basis because a lot of people will say, well, why don't you just call the outreach worker? The outreach worker would go and get it. But the outreach worker may not have the vehicle that will permit for this woman to come. And there's a lot of lack of resources, but lack of information. And I think it's when those two worlds start working together that maybe a solution to that very problem could be found. If we're all talking together and in our silos, we're losing people. We're losing women. A lot of them are living a lot of atrocities just because we can't talk to each other. And so I think that this was for me mind affirming that I need to do more. I need to do more, and I need to reach more to the network, to the disabled network, to learn more from them. And maybe I need to find to put all this information that will be given to me and translate it to the anti-violence world so that they also understand that they have a big role to play. And then we need to also look at our community approach, our integrated community approach. Do they really have everybody around the table? There's everybody there, and I don't think so. And I think if we did a quick scan of all our community approaches, integrated approach, we would find that they're lacking. And I think in that when we're lacking, there's people that unfortunately are hurt by it.
Right.
Now, if I could, we'll take 5 minutes and go through our next step. But we're hoping we'll come out of this. And we hope, again, from all your help for the people that are online, we'll talk about what we hope to put together, which is really a toolkit for service providers. Larissa, I think? Yeah.
Yeah, so this is Larissa, and I'm a social work student completing my social action placement at the center. And so I'm just going to talk briefly about our table of contents for our toolkit. So we've just been kind of, as we've gone through some of the survey results and talked to some of our focus groups and just conversations among ourselves, we've kind of come up with some things that we feel like would be important to put into a toolkit. And so our first kind of section for the toolkit is on just some basic things to go over: signs of family violence and intimate partner violence, a discussion around defining disability like we've had here, just because that's really helpful for service providers, especially where we're working with some service providers who may be coming from a social lens and some from a medical lens. Looking at appropriate language on how to refer to a person with disability or a woman experiencing violence, and some of the ways that those intersect in appropriate language to use. Tips for advocacy for working with people who may need either services or both. And just information on trauma, like Rina had said, so that we can help service providers to better understand the lens that we're working from here. So then we kind of branch off. We had two different sections. So the first section is on information for interpersonal violence service providers. And like Rina had said to me earlier today, I think we don't want to reinvent the wheel. So DAWN, which is the Disabled Women's Network, has a toolkit for diversity through inclusive practice, and we've been just kind of looking at that. And they have an evolving toolkit and checklist that you can find on their website. Actually, it's really helpful. So the things that we thought were important were contacts for organizations providing services to people with disabilities, ways for women with disabilities at risk of intimate partner violence, contact information for those who can provide sign language interpretation, both English and French, information on turning written materials into audio and video files, information on communicating through images and videos through clients who have low levels of literacy, and the importance of interpretation versus translation. Someone in the deaf community had pointed out to us that often we talk about translation, but really we should be focusing on interpretation because they may not use the same words as we do and the same concepts. I also talked about the importance of providing information on accessibility grants for building modifications, information on traumatic brain injuries or disabilities caused by family and intimate partner violence. Some of the things that Dawn had on their website had pointed out were things like the importance of a rest area for people who get tired midway through a day, keeping times firm for transportation, using not harsh lighting, keeping places scent-free, temperature and air quality, eliminating background noise, being sensitive to allergies, making space for assistive equipment, making sure that bathrooms are wide enough to permit that, interpretation, translation, and also captioning at certain events. Captioning can be really helpful for those in the deaf community, and then care for service animals. And then so for the disability support service providers, some of the information we want to include in our toolkit includes tools to assess the levels of violence, information on what to look for, what questions to ask if you suspect that a client is experiencing family or intimate partner violence or interpersonal violence, as we had said earlier. Contact information for service providers who address family violence, contact information for accessible transition houses, and just information on what it means for accessibility for different populations. I think, like we had said earlier, one comment that we received at our focus group for the disability service providers had said things like for someone who's deaf, the importance of having, a way that they could signal if someone's knocking at the door, they might not hear the knock, but if there was a light or something, that would be really helpful. So that can also be included in accessibility. And then just information on the best ways to follow up with a woman throughout the process. And we talked about it earlier. A lot of disability service providers don't want to just refer the woman and then kind of
hope for the best.
Hope for the best, yeah. Yeah, so they want to be able to follow up with that and make sure that they're building those community relationships. And then so the last section there is the additional information. We had talked about how to discuss healthy relationships and sexuality with women with disabilities. Like Rina had said, sometimes the education that these women are receiving is more focused on how to adapt to living in a world of people without disabilities, and so we need to be sensitive to talking about that and just some of the double standards that we have, like it's appropriate. Not necessarily appropriate, but an able-bodied woman might go to the bar and hook up with whoever, whereas we would tell a disabled woman that that's very dangerous, and so just kind of being mindful of the way that we talk about relationships with people and how we're addressing those things. We addressed the fear of disclosure, how to respond when someone discloses. We talked about the importance of empathetic listening skills, and then we also want to include, numbers, like kind of a directory for transition houses, resources, and other helplines.
Thank you, Larissa. And again, these are the questions that we pose, and I know that it's kind of difficult in a presentation like this today, but just want you to keep those questions in mind, and if you could share some of your answers with us, we'd certainly be able to include them somewhere in whatever we are going to develop moving forward. But our next step is certainly to now have a couple of focus groups with service providers that are working in the anti-violence field. We also hoping to have focus groups with the Francophone communities, and then moving forward having focus group or individual interviews with women with disability. And I got to say that I have learned so much since we've started this work, because the entire work has always been to push our mind forward. What does accessibility mean? And accessibility to whom? And how? And so, moving forward of trying to get women to come forward and talk to us will also be difficult, because I know some of the women that I worked 11 years in a transition house, and I know the difficulties that they have encountered with transition house because they didn't fit. They didn't feel they fitted. And so we need to think about that. What does that mean? So as you see, we have a lot more questions and answers, but it's certainly wonderful to have the question, because if you have the question, you may find the answers. But if you never question, you will never be able to give some answers. So, Sally, were there other questions? I know we have almost 3 minutes. The last slide.
Yeah, I'm trying to sort of sort through and triage, and I think that people are hungry to sort of leave on I think that was a very hopeful note, that, at least we have the questions. And so I guess there's 2 questions that I would just pose you, and you can sort of muse on, and one of them is, where are the glimmers of hope? So what are the promising practices or emerging things that you're seeing that are giving you and your team hope on this? And then the other one for the profession is, do social workers have a special responsibility or role on this issue, and why?
Best practices. I guess for best practices, we'll have to wait till this study has more information, and for the study that Dawn is doing, that will have more information. And what we know so far, for having spoken to Bonnie, is that both studies validate each other. The issues that we came up with are the same issues that they found in Ontario, in Quebec, and in BC. So now we need to learn from that. And so that's why we're looking at the stories of intervention that were successful, because we may learn from them. That could build our best practice. Yes, social workers have a big role to play on this, because we need to know that our intervention moving forward has to be informed by this information. I'll go back to a story that I have been told by one of the women that told me that she couldn't hear or could not speak, that when she went to see her social worker, even though it is her right to have sign language translators there, she was asked to write her stories instead of having somebody translate what she was saying, and which is awful. I don't know anybody that's on the phone or here around the table that could write their stories when they're in trauma, when they're in crisis. And so we need to be aware of our own intervention, of what we need to know, and we need to get to know our community and to know where I can go to access the information I need from maybe the world of the disabled people. People with disability, the service providers can certainly help us here in moving forward.
Right. I mean, I think what's obvious is that from the questions and the comments and everybody sort of sympathizing and agreeing with the early data that you've collected through these projects, is that this is something we need to follow, and I think definitely fuel for a second webinar or maybe a series of webinars. And so with that, we're right up against the hour, so I just have to say another huge thank you to all of our presenters, especially to the Muriel McQueen Fergusson Centre for Family Violence, and for all of the amazing work that you and your team are doing. I know I learned so much today, and that the audience learned so much today. We're getting many messages of thanks from the audience right now. And on the housekeeping side, again, the recording of this will be uploaded to our website tomorrow. It's under the Continuing Education tab. For those who require it, that confirmation of attendance is available now by clicking the yellow icon at the bottom of your window. And so with that, another huge thank you to our speakers. Thanks to the audience for your engagement and your attention, and we will see you next time. Thanks.
Thank you, Sally. It was wonderful.